Hi everyone, and welcome to this week's Morning Buzz. I'm Coco Woods. We have a new series featuring COVID-19 heroes. It's our way of saying thanks to everyone doing their part to keep us safe, happy, and healthy. In honor of National Nurses Week, our first episode of this series features nurses.
Every week, we will be highlighting those who are on the front lines of the battle with the COVID-19 outbreak. This week, we wanted to say thank you to the nurses working to combat the virus. Nurses and hospital staff members are going into work risking their health to help others. Most hospitals are packed with patients, so staff members are working long and stressful hours. Some nurses have even posted pictures of the bruises they've received from wearing protective masks all day. We want to say thank you to all the nurses across the country for their bravery during this time. And remember to stay safe and practice social distancing to prevent the spread of COVID-19.
Speaking of nurses, we'd like to thank our CHS nurses, Miss Hall and Mrs. Drake, for being awesome. Before the school buildings closed, we had the chance to meet up with them to learn how to use an EpiPen. Today I'm here in the nurse's office with Mrs. Drake to talk about EpiPens.
The fourth dimension is my own mansion. It's all messed up, I don't care. Cause what fun is there in ever making sense?
So what is an EpiPen?
An EpiPen is a device that will release epinephrine into a person who is having an allergic reaction.
What is epinephrine?
Epinephrine is a naturally occurring chemical in a person's body, but somebody who has an allergic reaction doesn't have enough of it, so what you're doing is you're giving them more epinephrine and able to combat the allergic reaction.
When should you use an EpiPen?
An EpiPen should be used on somebody who not only has a known allergy, but maybe somebody who has a first-time allergy, because it's better to give an EpiPen than to not, so that you're not letting time go by and the allergy could become more severe.
Who can administer an EpiPen?
Anybody can administer an EpiPen, but if you want specific training, we are always glad to teach you. So Izzy is our patient, and she thinks she's having an allergic reaction. Some signs of an allergic reaction might be she's having trouble breathing, her tongue feels numb or very fat, and her eyes might be swelling, or she has a rash, and she knows that, say, she's allergic to bee stings. She went out for gym, she got stung by a bee, and she came inside and she's not feeling well. So we know that Izzy needs to use an EpiPen, okay? So the first one is the name brand EpiPen, and what you would do with this, you would take it out of its case, you would take off the blue top, and you would hold it in the middle, and you would find a nice spot on her leg in the muscle, and you would push down. When you push down, you count to 10. That allows all the medicine, epinephrine, to go into her muscle, and then when you pull out, the needle will retract, and then you just rub. The next one that kids might have in their backpack is one called an AuviQ, and this is one that talks to you, okay? And what you would do is you would open it out of its case.
This trainer contains
It will talk.
no needle or drug and is for training purposes only. Do not use this trainer during an allergic emergency. Pull red safety
You would pull the
bar
red
down
off.
and off of this trainer. Place black end against outer thigh. Then push firmly until you hear 2, 1. Training complete.
And then you would rub her leg,
This trainer
and that gets the medicine
used for
going
training
throughout her whole body.
purposes.
And you must call 911 and bring this person to the hospital if they have received an EpiPen. Thank you so much.
You're welcome. Thank you so much for coming and being interested. We really appreciate that. The more people who know, the better.
Thank you very much to our teachers. Thank you very much to our teachers. Thank you very much to our teachers. I love our teachers.
Sports may be taking a break, but we're still covering stories surrounding our favorite pastimes. Here's a look at sports this week with John Golavita.
For the next few weeks, we will be highlighting the top 5 most inspiring athletes of all time. This week we will be featuring Vince Papale, a wide receiver for the Philadelphia Eagles during the late 1970s. I know many of you don't know Vince Papale, but his story is nearly unmatched. He was born in the suburbs of Philadelphia and played basketball and football and ran track in high school. After high school, he earned a scholarship to do the long jump, the triple jump, and pole vault for the track team at St. Joseph's University. He did not play football in college as St. Joe's did not have a team. After college, Papale went on to play professional football for the Aston Green Knights and the Philadelphia Bell. He was also a substitute teacher and JV football coach while playing for both teams. In 1976, Papale caught the attention of first-year head coach of the Philadelphia Eagles, Dick Vermeil. Vermeil was impressed by Papale's special teams abilities and brought him in for a meeting and a chance to play in the NFL. He ultimately made the team at age 30, making him the oldest rookie in NFL history. Papale played for 3 seasons, all with the Eagles, ending his career with 2 fumble recoveries, 20 tackles, and 1 reception for 15 yards. In 2006, Disney released a movie entitled Invincible about Papale, portrayed by Mark Wahlberg, and his road to making the Eagles in 1976. Today, he is a motivational speaker and a member of the Philadelphia Sports Hall of Fame.
Now let's take another look at last week's Guess Who. Could you name this baby? Well, it was none other than Miss Rich.
That's all for this week, everyone. Thanks for watching and have a great weekend.